At the same time, Milwaukee is working on implementing its own face mask requirement. Health Secretary-designee Andrea Palm is helping manage the coronavirus response in Wisconsin as we experience the biggest surge to date. And Andrea Palm joins us this week. Thanks very much for doing so.
Thanks for having me.
So reporting this week showed that Wisconsin's COVID-19 reproduction rate is the worst in the nation. What should we make of that?
So I think we have had the good fortune here in Wisconsin of watching both now and when it first arrived here in the States, other states who have been sort of on the leading edge of this. And so I think as we see our reproduction number and our surge happening here in Wisconsin, we need to take note of what we're seeing around the country and do what we need to do as a state to pull back together, to stop the spread, to reduce our surge from becoming worse, and so that we don't get ourselves in a place where we look like some of our neighboring and other states around the country.
So our numbers have doubled in the past 6 weeks. What have contact tracers been able to show you and other public health officials about where those cases are coming from?
So I think there's a couple of things worth noting in the data we're seeing from our contact tracers. One is what we're seeing here and around the country is that there is a large uptick in our 20-somethings who are becoming infected with COVID-19. And then secondly, our surge is also being driven by mass gatherings, by everything from barbecues and bars and restaurants and other types of events where people are not social distancing, not wearing masks, and are in large groups that help reduce our ability to really do good contact tracing, get to the root of it, and stop the spread.
So mass gatherings like over the 4th of July, for example, where we saw large crowds in the Wisconsin Dells at the water parks, when will any positive cases from last weekend's kind of mass gatherings show up?
So as we've learned many things throughout this pandemic, one of the things we know about this virus is symptom onset is anywhere from a few days to 14 days. And so we certainly could start to see cases from mass gatherings that happened over the weekend, late this week. But what I think is most important is that folks who were at mass gatherings should take the steps to protect themselves, to protect their families. So self-isolate, monitor for symptoms, get a test, talk to your healthcare provider if you have even the mildest symptoms. But make sure if you were at a gathering that you take the necessary steps to protect yourself and those in your community from the spread of COVID-19.
Have we seen evidence that any of the mass gatherings by way of racial justice protests caused an increase in cases?
So as you know, one of the things you get in a contact tracing interview is information about where people have been. And so mass gatherings, as I mentioned, is a driver in our surge right now. But the bulk of what we're seeing in our data is not from those who participated in protests, but in other types of mass gatherings, house parties, bars, restaurants, places where there wasn't good social distancing and mask wearing. But the protests particularly are not coming up in great numbers in the data we're getting from contact.
As you well know, Governor Evers just imposed a mask mandate for state employees inside state buildings, and he will not reopen state buildings as planned. Would you, if you could, impose a mask mandate statewide?
So I think the thing about masks, there are a couple of things I would say. One, the evidence around the use of masks and their effectiveness as a tool to stop the spread has really developed over the last couple of months. And so we absolutely are strongly encouraging folks around Wisconsin to pitch in and wear a mask and help stop the spread. I think as it relates to state employees, again, we are trying to lead by example, to walk the walk and to be part of a solution statewide as we work with local public health and the tools that they have to help reduce the spread through orders and ordinances, et cetera, that they are all working to do around the state. And we are trying to be partners with them in that effort.
Speaking of local health departments, our next guest is a county executive who says that it's his belief that most counties, except for Madison and Milwaukee, except in Madison and Milwaukee, are hamstrung because he says they don't have health codes that could address these kinds of circumstances on their books. What about that kind of frustration?
So public health outbreaks, contagious diseases are things that local public health has the tools and has always had the tools, whether it's measles, whether it's sexually transmitted diseases, tuberculosis. This falls into that category. And so, isolation and quarantine, other sorts of public health outbreak tools are certainly things that our local public health departments have. He certainly could be talking about other things that I'm not aware of specifically, but we certainly want to make sure that our local public health partners have the tools that they need to stop the spread of this disease.
Meanwhile, as you also well know, 2/3 of Wisconsin counties are in the high transmission category right now. What, in your expert opinion, would be the threshold for a declaration of a new statewide emergency?
Mm-hmm. So this dashboard was intended really to help provide some of that kind of information to locals as they try to understand what's happening on the ground in their communities, right? It's about disease activity, the trajectory that disease is going. Is it getting better? Have we not seen a significant change? Is it getting worse? It really helps you understand directionally whether the things we are doing on the ground, that local public health and their local electeds, whether it's helping us move in the right direction. And so we would want to look at all that kind of information. Hospital capacity, how are they doing? What's their ICUs? How are they looking to make decisions like that moving forward? But right, this is the day-to-day kind of thing in real time that we need to be working very closely with local public health to do.
All right, we need to leave it there. Thank you for joining us, and thank you for your work, Secretary Designee Andrea Palm.
Thank you so much.